Greetings, members of the American Society of Colorectal Surgeons. I'm Sonia Ramamoorthy. I'm the Chief of Colorectal Surgery at UC San Diego and the current president of ASCARS. The annual scientific meeting is 2 short weeks away, and on behalf of the program committee and the executive council, I am excited to welcome you to San Diego. I want to share the amazing accomplishments of the past year. An abbreviated version of this presentation occurs at the annual scientific business meeting on the last day of the meeting, but as many of us must return to our practices and are unable to attend the meeting in some cases, I want to give you a brief overview of the state of the society, some of our achievements this year, and work that is in progress. A quick overview of what I'm going to talk about. Since becoming a self-managed organization, we continue to evolve our governance structure and headquarter operations, and this year was no different. As the specialty grows, so must our organizational efficiency and strategic planning. We are on strong footing from a financial standpoint, but as our society grows and continues to support more member benefit, such as our educational content and our Leadership Institute, we must lean into our development and fundraising opportunities, such as the 125th campaign. We'll talk briefly about our growing membership, some of our excellent flagship products and program services that we are known for globally, our ever-increasing value to members, some of the highlights of our touch points with industry and organizational partners, and the anticipation of a new strategic plan, which is on the horizon. None of the achievements that I'm going to be talking about here are possible without a very strong and effective and contributing executive council, and I'm truly grateful and honored to have worked with this incredible group of people. Our strategic plan is largely an growth of our mission and vision and our core values, and those are visible on our website. The 23 to 25 strategic plan focused on 4 areas. We had 15 strategies with over 50 concurrent operational tactics, and they focused in these 4 areas: membership, educational engagement, organizational relationships, and operational excellence and sustainability. So focusing on our first strategy, which was ASCARS membership and engagement, we've reached a record high number of members at 4,800 by the end of 2024. And I will show you a graphic which demonstrates that there's growth in every aspect of ASCARS membership. And this is just a credit to all the offerings we have as the premier colorectal society. Recent accomplishments that I want to bring to your attention is that 96% of our graduating colorectal fellows are now members of ASCARS. This was a very intentional effort to collaborate with the APDCRS to ensure that we can steward our young trainees into the society seamlessly. We also wanted to create an educational track for the other members of our team, our NPs and PAs, and you'll see at the annual scientific meeting an APP track to provide increasing education. And we hope as they find more value through our society that we can increase our membership of these valuable team members. Finally, I want to say thanks to our membership committee who really pushed through this quick pay option that allows us to pay our membership dues in a very efficient way. About 30% of our members made use of this new quick pay option. I myself used it, and it was very easy to use, and it certainly makes paying your dues incredibly easy. So coming soon will be an ASCARS member app that will allow you to access the website content on your smartphone, and a new option for members to use their digital wallet to make donations and payments. So as promised, this is the grid looking at our ASCARS membership, and you can see here the incredible growth that we've seen year over year, in particular in that purple column, which is representing our candidate members, our light blue there, which represents our international members. We are the global premier society for colorectal surgeons throughout the world, and as we continue to build our educational platform, there's an increasing demand for it. Our regular members are in green, and our ASCARS fellows in the navy blue. Speaking of engagement, one of the areas that we know is extremely important is through our social media content. While we are managing multi-generations within the society, our up-and-coming generation is particularly focused in this way of communicating. We're so very proud of our podcasters on Gut Check who really take such incredible content, the equivalent to sitting down and having a conversation in the surgeon's lounge, and really really bringing up their perspective. It's a very instructive, educational, and entertaining way to think about practice management issues, and disease management. Additionally, we have initiated a couple surveys and initiatives this year that we're very proud of. One is the HEC survey through our Health Economics Committee. You may have filled out that survey. It closed recently, and we will get the report of that at our annual scientific meeting. I want to thank our Health Economics Committee and Don Colvin for pushing that content through. That's a really important snapshot of our practice across this country, and it's particularly important for our younger generations as they navigate the landscape of healthcare to really understand the practice environment. At our retreat this year, the Executive Council really wanted to focus on early onset colorectal cancer. So that's one of our initiatives that you see here. We decided we wanted to spend the next 3 to 5 years focused on this area, as the data is telling us that by 2030 it'll be the number one cancer in patients 20 to 49 years old. So an important focus for us. But within a couple months, our incredible staff put together a toolkit, which we saw all over social media, and using that outreach, we were able to have an incredible impact with the campaign, which you see below on all the different social media platforms. It's just that's a indication of the power our members have to reach out to the public, reach out to each other, and reach out to patients. Our premier educational platform is AskRSU, and you can see here the numbers are climbing every year of those that want to access this incredible platform. We've had 120,000 views since its launch. 20% of those are international. We have an average of 19 minutes spent on the website accessing everything from the textbooks to different content from the annual scientific meeting. So really an incredible asset. And this is the focus of our 125th campaign, because we want to expand the offering of AskRSU to include all the content that we have, including that from the Surgical Leadership Institute, everything from the Management and Health Economics and Coding Corner. All of these things we want to make easily accessible to our members. I am so proud to welcome our new AskRSU Dean, who is Glenn Alt from USC, and the two Associate Deans, Dr. Dorna Jafari from Cornell and Dr. Hugh Echern from UCSF. Speaking of engagement, task force and committee work is really the lifeblood of this society. These are the boots on the ground. This helps us understand what our members want and need, and through our committee network is how we design our strategic plans. I've listed a few here. All of our committees are incredibly important to the growth of the society. The Women's Colorectal Task Force, led by Melissa Chang, has designed a survey. This will be released during the annual scientific meeting to better understand how we might serve women colorectal surgeons. Our membership committee, led by Jacob Eisdorfer, has had an incredible impact on our membership, not just the growth that you see, but taking those members who are eligible to become fellows and ensuring that we properly move them along in the process, and then, of course, making the ability to pay our membership dues more efficient through quick pay. Our International Engagement Committee, led by Vince Obius, was really designed to help improve the experience for our international guests at our annual scientific meeting, and to create these reciprocal grants where we will have surgeons from AskRS traveling to international meetings and vice versa. We've initiated a search for a new editor of DCR, and George Chang is heading that committee. That search is closing to applications at the end of April, and we think it'll take the better part of the year to conduct that search process, hoping to name the new editor by the end of 2025. Our Health Economics Committee, led by Don Colvin, has recently closed their comp survey. The results of that will be released at the annual scientific meeting. The APP Task Force, led by Liza Wick, recently closed their survey as well, and this is going to help us design content during the annual scientific meeting and throughout the year for our NPs and PAs in our practice. The Surgical Leadership Institute is gathering more steam, and hopefully we'll hear more in 2025 and 26 about those offerings. That'll be led by Glenn Alt. I want to say that we made a very important strategic decision this year to bring the Fellows Career Course, that legacy course that I attended even 25 years ago, under the ASCRS umbrella to help operationalize it and to ensure that this incredible course lives on for future colorectal fellows. Linda Farkas, leading the Rectal Cancer Committee, was able to put out a new Fundamentals of Rectal Cancer, as well as Shankar Raman on self-assessment with a new CARSEP. ASCRS U, Najia Mahmood, has been the existing dean, but as she moves on to be president of the society, that'll be taken over by our new leadership. And they have created a pilot with the Indian Society that has brought in 200 members into ASCRS, mainly to access the educational content. So a really important initiative started there. Some of the takeaways from our retreat I just wanted to share with you was this decision to take the lead nationally on early onset colorectal cancer. You'll see more advocacy and education in the ensuing months and years. That'll be the offshoot of that decision. In particular, working in collaboration with our advocacy groups, the Colon Cancer Alliance and Fight for Colorectal Cancer. We focused a lot on operational efficiency, so realignment of our committees. You may see some consolidation this year, and this is just a really important exercise for us with stewardship of the society. We've started our quality registry initially in the anorectal area, and hopefully that'll be opened up to more people to participate in this year. Our international engagement, creating more educational opportunities, collaboration and collegiality across the globe, and of course the offerings through ASCRS U. We had 450 people apply for committee positions, and we were able to place 154 new members with a total of 707 distinct individuals who serve on 28 standing committees. That's an incredible amount of engagement and lots to be proud of. Again, our committees and our task force are the lifeblood of our society. They tell us directionally if we're going in the right direction, things that are new, things that are impacting practice, or the diseases we treat. We are truly grateful to our committee members and our chairs for their hard work. One of the important aspects of engagement is building connections domestically, and through One Colorectal Community, which is the congregation of the American Board of Colorectal Surgery, our American College of Surgeon Reps, the APDCRS, DCR, our Research Foundation, and RRC, with ASCRS being the convener. We meet monthly to quarterly to discuss common areas of celebration, concern. We are able to align our strategies and look ahead to see how we can all best serve the members of our society. Our regional societies are becoming increasingly important. We recognize the valuable service that they provide to our membership out in different states and in communities. Many folks cannot travel to the annual scientific meeting, but they do get to the regional meetings. So we're looking to strengthen our connection and collaboration with our regional societies over the coming years. I want to thank Alessandro Fichera for bringing our regional societies back in so that we can, again, provide that collaboration and communication to better serve our members through this hub and spoke. Other entities with which we are very closely affiliated with through different membership activities, the AMA, the American College of Surgeons, our advocacy groups, Colon Cancer Alliance, Fight for Colorectal Cancer, and different groups through which we advocate through either for the benefit of our patients or the diseases that we treat. We are a global society. 20% of our annual scientific meeting attendees come from over our borders. They are important contributors to posters and podiums and our education content within our annual scientific meeting. 31% of our DCR editorial board is international, and over 50% of our DCR manuscripts come from abroad. So we are the global leaders, and we have a mission to fulfill in this regard. With over 600 members and fellows of ASCRS who are from over the border, it's really important that we think about ways in which we can collaborate and work more closely with different countries to elevate the care of colorectal cancer patients throughout the world. There is a growing interest from our members to connect, both in service of third world countries, but also to collaborate in areas of research and common interest. And we hope to help facilitate those bonds, contributing overall to the global colorectal health and education. So as we build those connections internationally, what have we initiated? We have always had officer visits from ASCRS to international meetings and vice versa. We have a focus at our annual scientific meeting, a spotlight of certain countries for San Diego meeting. India, Mexico, the Philippines, and South Korea will be featured. The presidents of those societies will be attending. We have an international symposium where we've asked them to speak. And of course, we have our corporate council scholarships that'll be announced at the annual scientific meeting. Again, where we are bringing international colleagues to our meeting, and we are funding our young surgeons to attend those international meetings outside of the U.S. The tripartite meeting is coming up in 2025 in Paris, and we will be hosting it in 2027 in New Orleans. We're looking forward to that. As I mentioned, we have a pilot program with India with offering a subscription to AskRS U with some access to our educational content. In future directions, we hope to develop more engagement with individual colorectal societies, both for our educational platform, but also through collaborative efforts. We also want to offer our AskRS members greater opportunities for philanthropic short-term clinical fellowships in the future. These are just some photos. We've highlighted a lot of the member stories in our AskRS Digest, all the good work that's being done internationally. AskRS is the convener of the One Colorectal Group, which brings together all the entities that really touch the lives of our colorectal surgeons. And I want to highlight some things that I haven't quite spoken about yet. We talked about the management of the fellows career course, that annual course that happens for fellows throughout the country. And it's an important course to build camaraderie, connection, and it's an opportunity for our mid-level and senior career colorectal surgeons to really share career advice with those coming up in our field. We made a landmark contribution of $2 million to the American Board of Colorectal Surgery. Historically, we'd always provided them with a small stipend every year, but it's clear the board needs to grow, expand. The location of the board is changing from Chicago to Dallas. The way in which the board administers the test had to change as well. And we believe this contribution will keep our board strong, which is incredibly important to AskRS and to our society. We also provide a stipend every year to the APDCRS, and that also requires an increase, not just for inflationary increases, but to help support the program directors, their educational content, and the evolution of our programs. So more to come on that. We have started an effort to explore the necessity to merge our 501c3 nonprofit status between the Research Foundation and AskRS. Currently, we both exist as two different 501c3s, but as we look at organizational efficiency and financial responsibility, we are exploring the pros and cons of merging our two entities into a single 501c3. We are also undergoing a renegotiation with our DCR publisher, Walter Kluwer, that is concluding late in the spring and early summer. And I have a slide, and we'll talk a little bit more about that. As I mentioned, we're in a DCR editor search, which will conclude at the end of this year. Coming up for our annual scientific meeting in San Diego, I'm excited to say that we have the highest number of submissions for the podium and posters this year. It's truly exciting. We've also had the highest number of pre-registrants for a meeting, so hopefully the weather holds out and we'll all have a wonderful time at this meeting. It is happening over Mother's Day weekend, so there will be recognition of Mother's Day, and new for us will be a family-friendly meeting, so we'll see how this works out. Perhaps this is the way the meetings will go in the future. We are welcoming the presidents of the Korean, Mexico, Philippines, and Indian colorectal societies, and we're really excited about our welcome reception, which is designed to be a block party. Speaking of the journal, we are in that editor search, as I mentioned. We are also in the renegotiation process with our publisher. One of the specifications for the publisher as we enter into our negotiations is that DCR must go online only. Now, this is not just DCR, this is the future. It's both an environmental and a sustainably responsible thing to do, but because the royalties to the publisher and all publishers have gone down, now that more content is available online, it is a cost-effective move to be online only. And honestly, if you've gone to the DCR website, there's so much more content there than you get out of the paper version of this. So starting in 2026, DCR will be online only. Looking at our ongoing discussions with the publisher as well, there's potentially future for an open access journal still to be determined, and some reduced royalties coming from DCR. Now, this is really important for us to think about because those royalties have always helped us offset our operational costs, and that may change in the future. We don't have an estimate of that right now, but we are looking at what's happening in the industry and across the industry, and this is one of the things that we are anticipating. Finally, I come to revenue development, as mentioned earlier. This is an incredibly important aspect of growth of any society, and the last time we ran a campaign was in 2010. So we are due. We have had incredible growth in this society. We've become self-managed and all the wonderful things we're doing, and I've only been able to highlight some of them here. But in order to sustain this and to grow it, we really do need to invest in ourselves. And I want to thank Met Much for being the head of the campaign and launching the 125th anniversary campaign. It'll continue for the next few years as we realize it may take us some time to reach our goal. We will make a heavy push at the annual scientific meeting and some friendly competition in there. We also continue to work very closely with our corporate council. We are truly grateful for all our corporate partners. We were fortunate to add Stryker and Arthrex Endoscopy to our corporate council this year, and they've become very valuable members. Some of the projects that have come out of the corporate council includes funding for the sustainability of ASCRS U, our education platform, creating the ASCRS Pathway program for those high school students that tour our exhibition hall at every meeting, our international engagement, these fellowships that we're creating for the reciprocity to attend meetings, our pelvic floor consortium, and the anastomotic leak project. If you haven't seen this already, we finally have merch. It'll be available online. It is really high quality. If you have a graduating fellow or a colleague you'd like to give a gift to, I highly recommend going to our store and considering some ASCRS merch. Finally, everything we do is an incredible collaboration between our executive council, our committees, and our extraordinary ASCRS staff. It's been an absolute pleasure to work with each and every single one of them, including David, our CEO, Erica Flynn, our Chief Learning and Engagement Officer, and Jason Keith, our Chief Development and Operations Officer. I want to thank them and express a lot of gratitude for all the hard work they do. And if you see any of them at the meeting, please give them a shout out, and to Christy Conley, who helps us put together an awesome annual scientific meeting every year. Finally, I want to conclude by welcoming our new executive council who will take over at the end of the business meeting of the annual scientific meeting, starting with our new president-elect, Dr. Najia Mahmood, and our new members at large, Dr. George Chang, Dr. Brian Kahn, and Dr. Dave Stewart. Thank you to the membership for your incredible contributions and engagement. It's been the honor of a lifetime serving as the president of this wonderful society. I look forward to hosting you in San Diego. See you soon.